Commemorations have taken place in the United States to mark the 17th anniversary of the 9/11 terror attacks. In New York, mourners have left flowers at the former site of the World Trade Center, which collapsed when two planes flew into them, killing more than 2,000 people. And at the Pentagon, another site of the attacks, a flag was unfurled in memory of those who died there. Well, nearly 2 decades later, people are still suffering from health problems from the falling debris of the Twin Towers. Let's get more on this and speak to Dr. Michael Crane, who's the director of the World Trade Center Health Program at Mount Sinai Hospital in New York. Many thanks for speaking to us on TRT World, Doctor. Tell us a bit more about these health risks associated with the towers.
So we see World Trade Center responders who have a variety of health conditions resulting from their exposure to the World Trade Center event, including respiratory conditions, cancer conditions, and mental health conditions. And these are now becoming somewhat more serious since they are mixing in with the conditions that are developing due to the patient's advancing age at 17 years after the exposure.
And what is the main cause? Is it the asbestos, the dust that came off these buildings?
Well, the dust was a combination of poisons. The building was on fire. It then collapsed. The pulverized dust was released. And the pile of materials, the so-called pile, remained on fire for weeks. And as the workers attempted to remove the debris and search for possible survivors, or then they were being exposed to both the dust itself and to the combustion products of that dust, which were very, very toxic combinations.
What is being done to help these people? Can anything be done?
So we monitor their health through a monitoring program. We then try to find if they have any conditions which the government has recognized as related to the World Trade Center exposure. If they have these conditions and we can demonstrate that to the government through a series of interchanges, we can offer free treatment for the conditions, and that includes for both the physical and the mental health condition.
Okay, good to speak to you, Dr. Michael Crane, Director of the World Trade Center Health Program at Mount Sinai Hospital in New York.